Did they not hear you at all? Okay. Okay. Live from the beach, where neither I nor anyone else in the room has had a Mai Tai today, even though it might seem like it. We are at the beach. We have lots of information for you all today. I hope you all enjoyed that fantastic barbecue. Thank you to Ronnie and your staff. That was really fabulous. I'm glad we were able to do that. So without further ado, we're going to start this off with Bridget Blum. Thank you, Michelle. Hi, everybody. I'm Bridget Blum, Director of Human Resources, and I just wanted to give you an update on the COVID Assistance Program, the COVID Assistance Fund that you all have very generously donated toward, or many of you have donated toward, extraordinarily generous donations. We have had somewhere about just 35 requests come through. I'm very pleased to say that all of the requests that have come through have been approved to this point. There are still requests coming every day. The average request on behalf of the employee is about $500. And there have been things like new tires that employees have requested so they can safely get back and forth to work. We've had a number of people request assistance with car payments and with other maintenance for their vehicle, rental assistance, lots of folks needing help with their Central Hudson utilities. We even have had a couple of folks put in some requests for their children to get Chromebooks so that they can do online learning at home. I know that the local district that I'm a part of only provides one Chromebook to a family. And for folks who have multiple children, you can only imagine how stressful that is to try to have the children doing homeschooling and only have access to one device. So it's been a wonderful fund, and we just all want to say thank you very much for creating that, starting that, and the employees are just overwhelmed with things. So that's my update for today. Thank you so much. Rob?
Good afternoon, everyone. I'm Robert Dunn, Director of Environmental Services. A couple things I want to touch on today. We did get a little backlogged on the garbage rooms. I know there have been some complaints about that. We should be mostly caught up by Friday, getting all those rooms picked up and cleaned up. We just got behind just for staffing. A couple other things too. A number of residents have called me about people not washing out their recyclables before they put it into the containers. Please make sure that they're washed out. If you don't wash out the containers, it needs to go into the trash. Also in the trash rooms, we're finding a lot of garbage is not being bagged up. If you could preferably bag it before you put it in to the container, that would be much greatly appreciated, just for the odors and containing that. Another thing too, housekeepers have mentioned if you could turn on your air conditioners before your housekeeping appointment. Some of the apartments are very warm, and now that they have to wear a mask to work in those conditions, it is very warm. So please turn on your ACs, about an hour before your appointment before that starts. And also, if you can return your mask to the front desk at either the end of the day or the next morning when you come down and pick up another mask. The cloth masks are not being returned, and we're handing more out than we're getting back. And we do need them so we can wash them daily and make sure that everyone has a cloth mask so they can walk around in. If you do have any questions, feel free to call me in the office anytime. Thank you. Bye.
Hi, everybody. Ronnie Licata, Dining Director. I want to say the same as Michelle. It was absolutely wonderful seeing everybody today, and hopefully we will see more of you in the near future. So the first thing I want to talk about is the disposable containers. We've been working with the Sustainability Committee to find a more sustainable product. There are, and as I've had discussions with them, there are lots of different containers. They all have pros and cons. With the supply chain being kind of wishy-washy, we're just trying to, bring in containers that will fix the purpose of delivering food as safely as we possibly can. We have heard a lot of people that have been somewhat unhappy with the box containers, and we are going to try to use those just for sandwiches and salads for now, and then the 3 compartment containers for hot foods. Hopefully this pandemic will be over ASAP and we can come up with a new permanent solution. On a good note, we have been working, and I think that there were some announcements to you guys on al fresco dining. So what that is going to look at like is, from the beginning, Tom thinks that he will have the awnings up at some point this week. Hopefully in the next week or 2, we will have what will look like al fresco dining, which is approximately 8 tables outside, reservations only, and very limited seating. There's not a lot of shaded seating. We're looking at whether or not we can come up with other solutions about that, but it will be limited reservations, and full details will be coming out about that. But we are really excited to start this program. And just so you know, from the food aspect, it will mimic what you are getting for to go. So if we're offering a sandwich, a salad, and say lasagna and baked chicken, that's what will be available in al fresco as well. Yeah, so more to come on that. There'll be a full announcement with the full expectations and how you can, well, we'll see you soon in the dining room, okay? All right, thank you.
Hi, everyone. I'm Shannon Scatoro, Director of Marketing. I just want to tell everyone that we're thrilled because marketing activity is really picking up again. We've had quite a few new tours. We have new move-ins. We have new closings happening. We're also going to have a virtual resident panel next Wednesday from 1 to 3, where quite a few of the residents are able to talk to an audience through Zoom. And tell them about their experience living here and why they chose to come here. We do have a few apartments available still, so if you know anyone that's interested or anyone that might want to attend the event, just give me a call or send me an email and we can extend an invitation to them. That's all I have for now. Thank you.
Hello, Tom Tango, Director of Plant Operations Security. A couple things. The pool. Around the 1st of July, we should be reopening the pool. It will have been freshly painted with new underwater lights. The underwater lights haven't worked in a long time. And it'll be freshly painted, the pool and the hot tub. And we also cleaned up all of the stainless steel grab bars and railings. It'll look like a brand new pool. That'll be sometime around beginning of July. We'll have that open. Also, in about 2 weeks, maybe a little less, we'll have the new bus here. The new bus will be coming in about 2 weeks. And some of you that helped us pick that out, that's the bus that's coming. I'll keep you up to speed on that. The other thing that's pretty exciting is we just started 2 new, we're in the process of filling 2 new part-time positions called resident technology assistants. A lot of people call Jason a lot for things like setting up Zoom meetings or issues with cell phones or setting up your computer in your home. Simple, standard consumer electronic, consumer technologies. We'll have people on staff. The schedules we haven't determined yet, but there'll be people who can come to your home and help you with these technological devices. They'll have some supplies that they would need to have. Like, so I don't want them coming to your apartment and realizing, oh, you need a battery. They'll have some batteries with them. They'll have some cables. They'll have things like that. So, we can. I really want it to be something where they go there and they solve the problem. They will also be coming to you only if you call and make an appointment through concierge, and they'll be coming on WorkSub, and the time they come to you will be chargeable, something that there will be a charge for. all that still we have to work out. But we just started looking. We just started getting applications in, so there'll be more coming on that. But that'll be something to be, especially right now when a lot of people need to communicate through Zoom and through other technological means. To have somebody on site that can help you quickly will really be good. Basically, that's all I have for now. A lot of things will be happening the next couple months. All right, thank you.
Okay, so hi everyone, Michelle Gramolia here. I'm just going to disinfect this, just so you know, in between each one, everyone's been disinfecting the mic. I have quite a bit to say, so I figured I'd just disinfect it quickly here. All right, so let's see. First and foremost, I want to thank Ronnie again and her staff for a fantastic barbecue. I also want to take a minute to thank Gretchen. Thank you, Gretchen. Gretchen has, like so many of our staff, in the last, I guess 3 months now, stepped into a role that none of us ever anticipated and has just absolutely knocked it out of the park in terms of taking live programming, live activities, and making this whole thing digital. Was not her forte. I don't think it will be her forte ever again when this is all said and done. But Gretchen, you've done an amazing job. So thank you. And I'm sure everyone echoes my sentiment. So thank you for that. Thank you to Kim for likewise being so flexible. Thank you to Deborah Moore, every single resident that has participated and given programming all day long. You should really all be proud of yourselves. This is a remarkable community. One thing I will note, and I've said this to Gretchen, by the time this is all said and done, the pattern of this carpet will be seared into everyone's brain because every programming has had this carpet in it, but it happens. That's right. Well, and so today we have the beach, so that's a good thing. I'm going to go through this in kind of just no particular order. Tomorrow at 3 p.m., we have a calendar ad for Rachel's interview. So yesterday, I recorded a Zoom interview with Rachel Mosicki, who is she's currently a nurse practitioner that provides services in our skilled nursing unit to complement Dr. DiNapoli's medical directorship. And for a few years, literally, I have been working to negotiate and have finally completed a partnership with Medical Associates of the Hudson Valley, Dr. Moss's practice, to be able to engage with Rachel and have Rachel provide nurse practitioner primary care services to our residents that might be interested from both independent living and assisted living. So this is the ideal situation for someone that maybe not in love with their primary care physician, may be tired of the rigmarole that you're facing dealing with big box medical practices, likes the idea of having a medical practitioner here on site. The medical office on site is located off of the health center lobby. It's a full exam room with a waiting area if you have not seen it. Currently, Dr. DiNapoli sees patients there, outside of skilled nursing, and Rachel is now going to be doing the same. So if you want to catch that interview between Rachel and I, we talk about her past and her experience, her vision, and a little bit about what the practice is going to look like. She is taking new patients, and we will assist you if you are interested in having all of your medical records transferred over to Rachel's practice. Dr. DiNapoli is also taking new patients. That's available to assisted living, garden view, and independent living residents. Not mandatory by any means, but another option for you to be able to receive care here on campus. And Rachel talks a little bit about the opportunities, some of the limitations, and we talk about insurance, which I know is a question that a number of you have had. So please try to tune in for that. Like this meeting and like many of the broadcasts that we're doing now, that interview will also be available on YouTube. So in an email tomorrow, I will send out a link to that interview and you can catch it on YouTube. Speaking of YouTube content and things that we've streamed, I think most of you know at this point that starting about a week and a half or 2 weeks ago, I endeavored to start taking some amateur video of interviews between myself and residents, staff, some ancillary interviews. I'm looking to do more related to social justice, civil and human rights, race relations, and really just trying to focus on the experiences of our residents as relates to, advocating for, equality, fair treatment, all those things to kind of figure out how can we change the conversation here at Woodland Pond, enhance the lives of our non-white staff, our people of color, potentially figure out true meaningful ways to increase diversity on this campus. There are limitations, but I think we need to stop allowing those to limit us. And I really want to move this conversation forward. So your stories have been inspiring to me. I'm trying to get better with the quality of the videoing. All of this is new technology to me too. If there are any residents that are interested in telling your story or has perspective on, ways that we might be able to, accomplish some enhancements, improvements, create community building, I am all ears. The intention of these interviews was to start the conversation, but this is just a start. We have a lot of opportunity. I'm thrilled that we're going down this road. If you have not caught those interviews, we've done, I think 8 so far, maybe 9. They are all available on our YouTube channel to replay at any time. You can watch them in sequence or you can watch them individually. And again, thank you all to everyone that has participated so far. I would love to be able to do a part 3 and a part 4, and then start to translate that into, new conversations. One thing I would just like to reflect on today about the barbecue, which again, I thought was fantastic and I loved seeing everyone. One of the fears that I have had about reopening was 100% evident at that barbecue. And this was just takeout. So there should have been, every reason that everybody could have kept their masks on and in place, not adjusting them. And there should have been every reason that everyone could have easily complied with the 6-foot distance rule. So I want to just show you something, and I'm going to put my stuff down so you can see. What I just did would give you 6 feet distance all around you. In order to assume that you have 6 feet distance around you at all times, you should be able to stand with your arms up like I just did and do a complete spin. There was a lot of compression of the line. Ronnie had marked the line, but I saw people just being a walker's distance apart. If it's someone that lives in your household, you can be touching each other. It doesn't matter. But if it's your neighbor that does not live in your household, or if it's a staff member, we have to be keeping 6-foot distance. These are the kinds of things that are going to tell us whether we are ready to move into the reopening phases. So I want to use this as an opportunity. If you can just think about your participation today in that line, or at the concierge desk, or in your interactions with the community, if you cannot put your 2 arms out in both directions like I just did, and do a full spin, you are not 6 feet apart. It's 6 feet in front, it's 6 feet in back, it's 6 feet, it should be 6 feet around you all the way. You shouldn't be able to touch anything. So please keep that in mind. It's just that full distance is what would be 6 feet. From here to here would be what you would need to do. So if you could just please keep that in mind. And then as to the masks, the masks are the bane of all of our existences right now, but it's what's keeping us from having viruses in a substantial way. And I think that the masks are going to be a long-term thing. I think from all of the guidance that we're hearing, from all of the news reports, from all of the information, these masks are going to be here to stay. So you're going to be hearing more and more education from us about the masks. Masks should not be touched once they're on, particularly the front part where your nose and mouth, could potentially aerosolize, any kind of droplets. No one should have their mask below their nose or above their mouth. It should fully cover your nose and your mouth. That is the only way to ensure that the droplets are not being spread. I completely understand and empathize with the challenges. I had absolutely no idea until the mask wearing was happening how much I personally rely on lip reading, how much the masks dampen the sound. It's also now creating frustration for me because I usually know all of you, you know that by face. With the longer hair, the grayer hair, the masks, it's getting hard for us to recognize people. So there's challenges with these masks, but ultimately they are helping us to stay virus free. So I'm just asking you all to do your part. Everybody's been fantastic with wearing them. I very rarely now see someone without a mask on, and I am so appreciative of that. I do see it here and there. We will continue to remind people. I'm not trying to be beastly, but this is going to take a community. So I'm happy to continue to do reminders, but it's really critical that the masks be worn properly because otherwise they're completely ineffective. So if you have any questions about that, you can see me, you can see Mary Jo, and certainly the concierge at this point are basically experts on the right way to wear a mask. So that's the masks. Okay. The next thing I wanted to talk about is my reopening plans and memos. So you know that I've been issuing memos of various sorts throughout COVID, and we are now sort of very carefully starting to reopen activities. I decided, with the advice of somebody that has Woodland Pond's best interest in mind, that it might be helpful if we did either a cheat sheet style format or a graphical format and update it each week so that you can have this. What occurred to me last night after I printed these was I should probably print them on a single side so that you can hang both pieces up in your home and you don't have to flip it. So you may see these be single-sided, but they will probably be to 2 sheets. I will update these each week. Things will come off of this as time goes on and things will get added, but very likely each week you're going to want to read the latest on each topic. So hopefully you've all seen this dated yesterday. Just some highlights. The loved one visit pilot program has been going successfully. One of the things that we have learned is that we don't have a lot of early risers here. So although we were offering 1-hour time slots between 7 a.m. and 7 p.m., we see the bulk of the visits happening between 11 a.m. and 6 p.m. So there is a lot of time that those chairs are not being utilized. We still have till the end of the day, Monday, to allow for visits. So if you are interested in a loved one visit, that can be a family member to a friend from the community, those kinds of things, certainly sign up while we're still doing that. One thing that I would just note that's not on the grid, because I haven't made a formal decision on this yet, but I think I'm going to feel comfortable putting the community on visitor pause for 2 weeks after this is done instead of 3 weeks, which is what we originally proposed. So I'm looking forward to that, but I'll put an announcement out about that soon. One of the questions that has come up related to the loved one's visit, and you'll see this repeated in this document frequently, is why can't we eat and drink on our visits? And the reason is because you cannot physically eat and drink and still have your mask on properly. So until we're in the phase where we're allowing al fresco dining, which we are not at yet, the masks are expected to be worn and no food or drink. Now, again, we are not policing what you're doing. We're providing recommendations. I have no interest nor inclination nor time or resources to police the activities of our independent living residents. But the guidance exists for a reason. We've had success at Woodland Pond for a reason, And I'm just asking for you to please, when you're with others, as we allow these activities to happen, to please wear your mask over your mouth and nose, and during these visits, no food or drink. The next topic covered here is medical transportation by Woodland Pond. So we are now back to being able to provide you transportation to your medical appointments. Some questions have arisen, and I tried to address them here, but we are not yet at the point where you can be going out to a medical appointment in a personal vehicle with somebody that does not live in your household, whether it's a Woodland Pond neighbor, a family member, etc. The only people that we are recommending that you ride in the vehicle with at this point, if they're not a member of your household, is a private duty companion that's approved. We have an approval process in place now. There's a badge system. These are people that are caring for you in your homes. You're having close access with them, and they can reasonably be treated like a member of your household. But to get into a vehicle with someone that you haven't seen in 90 days, you have no idea their COVID status, they have no idea yours, and to sit 2 feet apart in the front seat of a car or 3.5 feet apart from the front to the back, it's a risk. So you can avoid that risk by taking transportation provided by Woodland Pond. We will have 3 vehicles again back in the fleet in another 2 weeks. We currently have 2. We have ample time slots available to take you, although we are still strongly recommending, because Ulster County and Dutchess County just went into phase 2, that you continue to have medical care through telemed appointments, and that you work with your medical practitioners to identify what's a critical appointment and what can be put off. We cannot make that decision for you, including Mary Jo. It's your responsibility to call your practitioner and say, do I need to come in? Can we do this over the computer? Can we do this over the phone? Can I put it off? And if the answer to that is you have to come in, please contact Mary Jo, let her know, and then she'll pass it along to Jason, and he will help you get scheduled on our fleet. We absolutely need 72 hours notice because we do have to ensure that we're only transporting folks from one household at a time. That's for the safety of you and our drivers. But Jason's got plenty of drivers available, and we can do things, 7 days a week. There's a little bit more flexibility now. So let us help you. If your doctor's office requires that our driver wait with you while you have to go, if you have to wait outside in the parking lot, which some practitioners are doing now, we have accommodations for that. Jason will help you figure all that out, but please let us help you with those medical transports. The hair salon, I think you all know, is back open. Like everything else with reopening plans, it's going to be, you're going to see the same themes. You're going to see reservation-based systems. You're going to see limited capacity. You're going to see, things are going to look different. There's going to be mask wearing, infection control procedures, et cetera. The biggest difference for residents right now that we'll be seeing, Sharon, is that residents must check in at the concierge before your appointment and then wait in the lobby until Sharon is ready for you. The concierge will be screening you, which is a visual and verbal screening, as well as taking your temperature, same as we're doing for the loved one visits. And that's to protect you and Sharon as you go into the very close proximity that will happen necessarily because of a hair appointment. So when you arrive at concierge, you will be given a safety tip sheet. You should have a seat in the lobby and read through those safety tips. It will explain what you can expect to experience in the salon. And mainly the differences that you will see, as I said, would be wearing a mask. Sharon will only be working with one person at a time, and she will be disinfecting the entire salon between each visit. So she's ready to get all of you caught up, but please be patient. I think there's about 80 people on the list right now. So she will make her progress, but we will get back on track with those appointments. The biggest news on the memo yesterday was one of the new reopening changes. So we are now comfortable allowing residents to visit with each other, and that was effective yesterday. So currently what that looks like is the visits are permitted outside, and that's outside anywhere. It does not have to be under just the tent or on one of our benches. So if you would like to visit with your Woodland Pond neighbors at your home, in your own outdoor space, you are welcome to do so. We are asking that you have no more than 4 residents per visit. And that is for one of the main reasons that you're going to hear as a theme throughout reopening, which is that we have a responsibility as an organization to be able to ensure that we can do as much as possible to contact trace if COVID is identified within the community among a resident. So to the extent that you're meeting with more than 4 people at a time, it's going to become harder and harder for you to remember, who was I with? What day was that? Where did we sit? So this is a mechanism to assist you with allowing us to be able to help contact trace should COVID happen. As soon as someone in independent living contracts COVID, that's a resident, just as we do with staff, we are going to need to make individual notifications to anyone that you may have potentially been exposed to. We're going to have to quarantine those people. So all of these things are efforts to ensure that we have access to the information that we need to have in order to contact trace. Masks are required at all times in these visits. No food or drinks still until alfresco dining starts opening up. 6 feet distance has to be maintained at all times. And you're going to need to self-assess to determine if you have symptoms of any illness. And I want to stop there for a second, because symptoms of illness is going to be something that you're going to start hearing from us a lot. So when COVID first was prevalent, you know, we had the 3 symptoms: a fever, shortness of breath, and a dry cough. It was signs everywhere from the CDC and everything else. What has been learned is that COVID presents differently in every case. There are some similarities. There are some people that are completely asymptomatic, that are carriers and are spreading this. There are some people that have no fever, never had a cough, you know, might have been stuffy, test positive. We've had people that had what they thought was a GI issue, test positive, no shortness of breath, no fever. So our general rule to all of you for until probably further notice is that if you are experiencing feelings of any illness, please consider not visiting. Give us a ring. Let us know you're not feeling well. We can provide you some guidance as to what to do next. We are going to be working with the resources available at the county health department, the state health department, to try to refine a list. But right now, what we are most comfortable with saying is if you feel ill, you should not be visiting with your neighbors. We can get you all of your meals. We've, you know, proven that we can deliver any meal, any newspaper, any memo, any package. But please, keeping each other healthy is going to be a self-assessment of, you know, do I really feel lousy today? And one of the things that is really hallmark about COVID, what we're finding is more people that do become symptomatic, many express feelings of fatigue or malaise. So if you're feeling, you know, a sort of more than usual level of tiredness or lack of, you know, oomph or drive or get up and go, you feel like you've been sleeping a lot, please call Mary Jo. If it's Monday through Friday, or if it's the weekend, you know, give concierge a call. Because what will happen is your medical practitioner will probably want you to have a test done. I think most of you know at this point that we have made arrangements with a traveling lab that can come to Woodland Pond and do a COVID test for you right here on campus. I think about 3 dozen of you have opted to do that. Some symptomatic, some not. It works out great, but it lets you know your status. So we're just going to talk in terms of general symptoms of illness as we look forward to each person taking responsibility for how they proceed through this reopening. Alfresco dining, we just talked about. We're in phase 2 in Ulster County, which means that we can begin alfresco dining, and we definitely want to do that. One of the things that Ronnie didn't mention that we have decided is that we're going to keep the alfresco dining available all day for set hours, and the reservations will happen throughout the day, including on Sundays. So it's not going to be a lunch period and then a dinner period. It's just going to be rolling throughout the day. So what I think will happen is that when you get a call for your dinner delivery, the hostess will probably ask you, would you like to make a reservation for al fresco dining? And I think that's probably how it's going to happen. But seating is going to be very limited. We have to properly space the tables. As Ronnie said, we're looking to increase as much shaded seating as possible so that we can allow as many of you to have that al fresco dining experience. And we should have those safety plans completely confirmed by maybe Monday or Tuesday. And that will coincide nicely with the awnings coming in by the end of the week. And hopefully by this time next week, we might have an opening date for you. Tom talked about the pool. IL resident and group activities. We are now in a phase in New York where group meetings of 10 or fewer folks can get together and have meetings. So we're going to work through some of those things. Not every group and not every activity is going to be able to be treated equally, unfortunately. There are certain things that just are not going to allow for safe distancing, card games being one of them. Some card games, I should say. Card games where, materials are shared or cards are shared between people, it's not going to be able to happen right away. Activities where, you have to be in close proximity, that's going to be a challenge. So probably next week, Gretchen, Sarah, and I'll probably start looking at the lists of all the committees and the groups to identify, what things can safely be spaced, what things can't be, and prioritize getting those things going again. We're targeting to resume some of that by the week of July 6th. So we'll look forward to that. The bank. In my memo yesterday, I mentioned that we didn't have a reopening date yet, and that remains confirmed, but we made some significant progress in the last day, and I'm optimistic that we might be able to open the bank towards the end of next week. The challenge has been Ulster Federal Credit Union is taking a more lax approach to infection control and safe distancing than we can. We're in a different situation because all of our residents are high risk. Some more than others, and they're sort of treating it as if it's a general population. So we have actually come up with some nice compromises, and I think that the bank will be able to open, if not the end of next week, then the beginning of the following week. The last thing that I wanted to do, and I'll actually read this because this is something that I've got a lot of questions on. Let me just start by saying that Woodland Pond is really bifurcated into two segments right now. As much as we don't like that, it's just the reality. Skilled nursing and assisted living are basically entirely governed by the New York State Department of Health. We are beholden to an extensive set of regulations. They're changing every day. The regulations that exist have now been layered with copious amounts of executive orders by the governor and his people, and we have very little say in what's happening in skilled nursing, Garden View, and assisted living right now. We have more flexibility, more say in what happens in independent living because those same executive orders, those same regulations don't exist. So what the burden of responsibility in independent living for us is to be able to sleep at night saying that we have done all that we can to try to provide a safe environment for 250, people over 62 that live in independent living, the number of staff that work in independent living, and doing so in a way that we feel is fair, reasonable, and allows you access to all of the things that you need. We have to be able to evidence in skilled nursing and assisted living that we are complying with the regulations. In independent living, the only folks that we're evidencing to is ourselves, and the proof is in the outcomes. So the next comment sort of ties into that. It states that independent living residents are not prohibited from leaving campus and never have been. We have strongly recommended that you engage in public activity off campus only if you deem it absolutely necessary. we continue with those same strong recommendations. Now, many of you have asked me to define public activity, engaging in public activity. And I cannot define that for you. You have to take that and interpret it in the way that you feel is appropriate. For some people, that means, I pass somebody on the rail trail. For others, they may think that that's not an engagement, it's just in passing. Others may, feel comfortable going to a curbside pickup or going in a grocery store. But there's a limit to what I can define for you as an independent living resident. We can just make the recommendation that if you must go into the public and have, engaging in public activity, that you think about, the need for that activity. We want you to get out. We want you to get outside. I love the idea of going for hikes and riding your bike and those kinds of things. And I think that you can safely do so guilt-free with your mask on and not worry that you're engaging with the public. But if you're going into the bank, or you're going into, not on campus, or if you're going into the drugstore or into the liquor store, for those that are actually open, that is engaging with the public, and each of those interactions potentially enters the risk of COVID. So you have to make your own risk assessment. I'm not going to be policing this. I can't. I'm not inclined to. You are all independent. If you were not able to make your own responsible choices, you wouldn't be in independent living anymore. But we can provide the guidance to say if it's every external interaction has risk. So what is the risk tolerance that you have? My family, we've had to develop a risk tolerance, and we've had to apply that to our lives. And that looks very, very different than some of my neighbors and some of my closest friends and some of my family. Each person has to develop their own risk tolerance. We can just make the recommendations. We do recommend that if you leave campus and engage with the public, that you should monitor yourself for symptoms of illness and take your temperature daily for 14 days. It's a simple thing. You don't need to quarantine, but you should just check yourself for symptoms of illness and take your temperature. On that point, I do know that some of you don't have access to an easily usable thermometer. Some of you only have oral and haven't used them in a long time. They're hard to see. Some of you don't have digital thermometers, and they're nearly impossible to get right now. So I've actually asked Rob Dunn to purchase wall-mounted, forehead height digital thermometers in each corridor of independent living. So that will allow residents in a touch-free manner to walk up to a thermometer and basically like lean in, and you'll be able to take your temp for you. So if you're one of the people that needs to be temped or monitor your symptoms, you'll be able to do that easily and hands-free. And so that's great, and we'll make that access available for all of you. The one caveat to this is if you do go to the hospital or an urgent care setting, you will need to quarantine for 14 days and continue to monitor yourself for signs and symptoms of illness. That's strictly related to an urgent care center or the hospital. That does not apply to medical visits at the doctor's office. The doctor's offices, dentist offices, eye doctor's offices now are all being very careful. They're using infection control procedures. A lot of you are able to do telemedicine, so you're able to avoid that. But if you do find that you need to go to the hospital or to an urgent care center, you will need to quarantine yourself. There is a way to accelerate your quarantine. So if you are quarantined for 14 days under that scenario, it's the same scenario that applies to folks that came back from Florida or folks that travel. If we do ask that you quarantine, there is a way to accelerate it using that traveling lab. It's a shorter quarantine period plus a blood test. So if you're interested in that, Mary Jo can give you information, or I can do so. I continue to encourage all of you that wish to be on our daily or weekly email sharing to give us your email address. We're continuing to try to put as much of this content onto YouTube so that people can access it in a variety of ways. I'm going to have an exciting memo coming out about Spectrum probably the end of next week as we continue to finalize the details on the new bulk rate contract that Rob was able to negotiate. And we just need to keep the communication flowing. So I thank you all very much. Oh, and Gretchen tells me we have a winner for the seashell counting contest. The winner, who guessed 500 seashells when there are actually 527 seashells, who counted them? Gretchen counted them. Connie Hornbeck. So Connie, you can pick up your prize at the concierge. Thanks, everyone. Stay healthy, and I'll see you all soon.